There we go. There we go. Yeah, so I started off as an intern, actually in my master's program. It was my second internship. And I usually tell people that I fell into it pretty accidentally, that I always was an animal lover. I used to volunteer with my animal shelter when I was a teenager. Um, but I didn't really consider veterinary social work at the time. I took the internship because the place I wanted decided they didn't want a macro level intern that year. And the other option was in Maryville, which is like 30 to 45-minute drive. And I didn't want to do it. So I was like, yeah, that's social work. That sounds fine. That'll work. And I ended up with a career, honestly. So I came back after about a year after my master's to do the PhD and did my work with vet social work and helped build the certificate programs, or at least the postgrad and MSSW versions. Vet human support they did without me. So I came back as an employee of UT in 2018, working with Habit, which is Human Animal Bond in Tennessee. It's our animal assisted activities program through the UT Vet School. And I came back working for Vet Social Work in 2021. So here we are. Okay, so you all three would be interested mostly in the postgrad, so I think that's what we'll focus on. But just so you are aware, in case anybody asks you, we have 3 certificate programs. So we have one for current master students. So that one, they get their master's of social work and the certificate at the same time. They could be in person or online. They can be advanced standing, full-time, or part-time. Okay, so it's built into their program, and they do 3 classes, project, and their field placement. And they earn a certificate at the same time, which is very cool. The veterinary human support certificate is for veterinary professionals. So this is really geared towards folks who are in a veterinary setting as a veterinary professional. So veterinarians, vet techs, vet nurses. Occasionally we do accept some other veterinary professionals as well, if it fits with what they're doing in the clinics. But we're really aiming this towards people that are doing the veterinary work and they want to continue doing veterinary work, but they would like some additional skills for working with people. So it's about things like mental health and communication and conflict management, etc., just to hopefully make that veterinary setting function smoother without becoming a mental health professional. And the last one is the postgrad. So this is for licensed mental health professionals. We do accept other professionals besides social workers. Their certificate does not say social work. For them, it will say veterinary mental health. Okay, because we know social work is title protected. That certificate, there is an application. You complete 4 online self-paced modules, which vary in length. They all consist of recorded presentations, readings, and quizzes. There are 8 what we call supervision sessions. They're more like group discussion, so providing scenarios that you can apply the information you learned in the modules with your colleagues as well as experienced veterinary social workers. Then we have 2 workshops. So we have one that's called the Veterinary Social Work Intensive. That one is focusing mainly on grief, the link, and the intentional well-being or compassion fatigue topics. Those are live online, and they're just, as you might think, more intense. So it's lots of role plays, lots of scenarios, lots of case discussions. So a way to think about it is you learn about it, you talk about it, you do it. Okay. Same thing applies for the animal assisted interventions workshop, which Augusta, the past several years, has been one of our facilitators for it, and we're very grateful for that. And there's a 250-hour Keystone project That sounds really big and scary, but I promise it's not. So this is the project that implements veterinary social work in some way. Okay, so we leave it very broad because we know people are in different points in their career, whether that's geographically or professionally, as well as their own goals, what their interest is. So it needs to implement vet social work in some way, and you have to have a consulting veterinarian that at minimum, they look over what you want to do in your proposal. Excuse me. From a veterinary perspective and let you know if there's any red flags or things that really need to be corrected before you get started. And at the end of it, look over what you did and sign off that you did it. If the project needs a veterinarian throughout, that's great. Or if they just want to be more involved, fabulous. We love it. Okay, but that's the very low bar. And the last step would be to present that at the International Veterinary Social Work Summit. It's a 5-minute presentation. We do it pre-recorded. And at that conference, you also say your oath. And just a little plug, that summit is happening this year, 2024, September 13th and 14th in Cleveland, Ohio. So it's not too far for you all. It's not your backyard, but not too far. And there will also be a virtual option. So, and everyone's welcome to that, whether you're in the certificate program or not. Okay. So that is a very quick description of the certificates. What questions do you have for me?
So I'm thinking about the Keystone project. I did pull it up so I just so I could see it too. Um, so it really it's so flexible and designed to help. Yeah. Um, does the setting matter, or is it as long as we have a veterinarian overseeing it?
Great. So I think this brings up a good thing that this question gets asked a lot is, do you have to work in a veterinary setting to be a veterinary social worker? And from our perspective, you do not. So from our perspective, a veterinary social worker attends to the human needs that arise in the human-animal relationship. So if you're doing that in a social work ethics perspective and doing that, you can be called a veterinary social worker. Okay. So yes, if you want to do yours where you're doing your humane education, yeah, that'd be great.
Yeah, yeah. I kind of envisioned a blended going with veterinary clinics and then my SPCA, but then also I mean, yeah, it's like any community, but especially our community, it seems there's definitely a need because yeah, we just to be able to go out into the community more. So that's a bit of what I'm hoping to do.
Cool.
Kelly Bremkin's stories of what she's been doing with Oregon Humane has given me a lot of ideas. My SPCA is very small, and we do not have that kind of budget to hire me in that capacity full time. So it's like, how do I craft this? And yeah,
So yeah, we've had a lot of variety. I mean, some people, yes, they volunteer and or get hired in a vet clinic and provide clinical services, and that's their project. But we've also had people work with their local domestic violence agency
cool.
to develop resources for victims that have pets. I have one woman who worked with her local shelter to kind of develop a program to keep families together, so pets and owners, and it also expanded to match pets that are going to be a good fit for a family. So
Yeah,
helping to reduce returns to the shelter,
excellent.
which also works to help the staff at the shelter.
Right.
Yeah, so I there's one woman in South Carolina that she actually ended up starting a nonprofit because she started giving her time in the vet clinic and kept getting so many people saying they wanted more services. So now she does that private practice. So there's a lot of room for creativity and flexibility.
Great.
So I also
Okay.
have somebody working on a podcast. which is pretty cool.
That is really cool.
So yeah, veterinary social work is a little over 20 years old,
Yeah.
but it's still growing, and it's very dynamic. So we think of new ways that humans and animals interact all the time, and how social work may need to be involved in that, and yeah, just changes.
Awesome. Yeah, thanks.
You're welcome. Okay, so the other thing, um, which I really appreciate what you brought up, Liz, talking about honoring how the effort that people who've taken the certificate have put in to call themselves a veterinary social worker. This is a certificate. It's continuing education. It is not a certification. Okay, so it's not a credential, right? That sounds really nitpicky, but a certification requires standards from a third party and an exam from a third party. Okay? So like your LCSW, yep, that's a license, but that kind of standard. An LDAC, licensed drug and alcohol counselor. Yeah. Okay. This is continuing education. So yes, there are people in our community who have been doing this work for decades, and they're not going to get our certificate, and they're still veterinary social workers, and that's okay. Okay. Um, we want people to get this education, particularly if it's new to them, so that they can practice competently. Okay, so and it doesn't have to be from us. There's other resources out there as well. So we're more interested in that you practice with the knowledge base and an evidence-based knowledge base in these settings. And so, but yes, so if you see somebody who has it, it's one of those kind of iffy things, because like there's nothing wrong with having VSW after your name, but it's not actually a credential. Okay. So if you want to call yourself a veterinary social worker, Liz, you can without the certificate.
Yeah, I was talking when I mentioned to Augusta, Augusta is what you said, and I was just sharing with Dr. Poe, like just my question, and that's simultaneous. Like I would love to honor those that went through everything, including their capstone. Like, how do we honor that while still saying, like, for me, I've been in veterinary medicine for 20 years. I've been a veterinary technician specialist running my own pain management rehab center for 15 years. So, and then I went to social work and graduated last year, right? So we have this like, Dr. Linden's like, you don't need to come down here and shadow us, Liz. You've been in the veterinary field for so long. But there's that connection that I think is super interesting. And with the program, like you said, there's like, especially with the veterinary social work aspect, there are multiple components, including the role playing, the connection with others, like all of that, that I think is really important. That is always helpful as a continuing education piece for anyone, whether you've been in the field for 20 years or 2 years, so I appreciate both of you, Augusta and Dr. Poe, and how you kind of delineated what that looks like and what that means. What I say is I'm under the auspice of what veterinary social work might look like at a more macro meso level. And so that's how I describe it to people, but I likely wouldn't put VSW just because I didn't get the certificate. And that's just my own preference, at this point. So
that's totally fine. And, we do like to emphasize that there are interventions on micro and macro. This is a field where, like I said, it's still growing and there's still a lot of opinions from a lot of different directions. So you will meet people who say that veterinary social work should only or is only in a veterinary clinic, that it's the one-on-one work. That is not what UT's vet social work stance is. We say that, it's the breadth, just like veterinary medicine has that breadth. You'll find veterinarians in government positions and in business and also in the little clinics. So just like social workers. So there are folks who are writing, mental health related programs and, doing all sorts of things. There's a veterinary social worker that works for the AVMA. She does not identify herself as a veterinary social worker, but she is a social worker in a veterinary setting. Mary Martin. Hey, Mary.
I was able to send out a mass email.
Okay, cool.
Hey. Well, hey.
There you are. So, Mary, I don't know if we've met before or not.
I've not met any of you before.
Okay, cool. So I'm Bethanie Poe. I'm our speaker tonight. I'm just talking about the certificate programs here at UT.
Okay. Basically, let's see. I graduated this past May with my master's of social work, and I have a bachelor's in OT and also. And so I was interested in the veterinarian side, and let's see, I'm now doing kind of a postgraduate internship at a emergency clinic under with a VSW.
Cool.
Yeah, and I'm finding it very interesting, and also and it had nothing to do with this or with what I've decided to do, but my daughter is a veterinarian.
Okay.
So I've learned a lot about from her, mental health from her, and wanting really to learn to support her through this whole process. And it has been, I have to say, it has been mind-boggling a little bit. And then on the other hand, it's just been an experience just being up in the clinic and watching everything go on.
Very cool. Okay.
So that's why I tuned in.
That's great. So I already gave kind of a little spiel about the postgrad certificate, but happy to run through it again. So I'll see if I can change it up, make it interesting for the other folks since they already heard it.
Sorry about that.
Hey, no problem. So we have 3 certificates, one for master's students, we have one for veterinary professionals, and then we have one for mental health professionals called the Postgraduate Veterinary Social Work Certificate. And this certificate is a continuing education certificate aimed at educating people about the 4 areas of veterinary social work. So in UT's model for veterinary social work, there are 4 areas. One is animal-assisted interventions, which Augusta is one of our experts on that. Animal-related grief and bereavement. Most people would refer to it as pet loss, but we broadened it a bit because relationships with animals go beyond pets. A link between human and animal violence. So why people that abuse animals often tend to also abuse people and how those connect. And the last one is what we're now calling intentional well-being. So we used to call it compassion fatigue and conflict management, but we changed it because we realized that as this field is growing and more attention is being paid to it, that the issues happening in veterinary medicine are much broader than just compassion fatigue and conflict. So we needed a term that was broad enough to cover all the things. So things like mental health and trauma and organizational well-being and communication and conflict management and policy and all those good things. So those are our 4 pillars. So in the certificate, you start off with 4 online modules, one for each of the areas. They're self-paced, they vary in length, but they all include recorded presentations, quizzes, and readings. Once you've completed those, you take 8 supervision sessions. There are 2 per each module, so total of 8. And they're basically group discussions. So we have 1 or 2 facilitators that have experience in that particular area, and you're provided with scenarios and questions where you and your colleagues can go through it and start applying information that you learned in the modules, as well as your own experience. Once you've completed the supervisions, you're eligible for our workshops. So there's one that covers, it's about a 4-day workshop. It covers grief, the link, and intentional well-being. And the other one is animal-assisted intervention. It's a 2-day workshop. And these are more interactive. So there's more role-playing and case scenarios and more discussions, guest speakers, etc. So the way we talk about it is learn about it, talk about it, do it. Okay. The last part of doing it is your Keystone project, which is 250 hours, which includes all the things like planning and researching and whatever else you need to do to get ready for your project. So it goes pretty quickly. And that we leave very broad. Okay, so it just needs to apply veterinary social work in some way. So depending on what your interest is and where you are and what you want to accomplish, it could look very different. We have some people that do go into veterinary clinics and are providing that mental health support, either for clients or staff, sometimes both. But I also have people who are working on policies and procedures manuals or ethical standards for the International Association of Veterinary Social Work. Or I have one woman working on a podcast. So we leave a lot of room for creativity. The main thing is it does need to implement that social work in some way, and you have to have a consulting veterinarian. Veterinary social work is inherently interdisciplinary. Okay? Social work is a human-focused profession. We need the animal people, whether that's veterinarians, vet techs, animal control, zookeepers, whoever, but those people that have that professional knowledge in animal welfare to work with us so we can address the human and animal. So we ask for a consulting veterinarian to look over your proposal before you get started to let you know from a veterinary perspective if there's any questions or things that need to change before you get started. Depending on your project, you may need a veterinarian through the whole thing. That's great. Or if they just want to be more involved, perfect. But that low bar is that they look over your proposal, say okay, and then when you're done, they look over what you did and sign off that you did it. Okay. And the last step is attending the Veterinary Social Work Summit, where your project is presented and saying Vet Social Work Oath. And we actually do, whether you do the certificate or not, we do have a summit this year in 2024. It is September 13th and 14th in Cleveland, Ohio. So, and there's also a virtual option. So whether you do a certificate or not, please hope you'll come. It's very fun. It's really great conference. So I know I just threw a lot of information at you. So let me know what kind of questions you have.
What's the average span that it takes somebody to complete it? It's always self-paced and different, but on average.
So typically people take about 2 years. Part of it depends on timing. I will say that starting in 2025, we're probably going to have an option, because let me back this up. The summit currently happens every 2 years. So that delays when people can finish. So like you could be done with everything, but you're still waiting on the summit to happen. So starting in 2025, we're probably going to have another option for presenting your keystone and getting done. So that will probably speed people up. But for a lot of people, it takes about 2. And we definitely understand, you know, life happens. So I don't like to stress people out about the timing, you know, so. Let's see, what else do you need to know?
So since we're recording this and we have some international people that are interested,
Yeah.
have you run across any differences when working? I know there's some people currently in the certificate that are in, the UK, in Europe, Australia. Have you noticed any differences or adjustments that have needed to be made?
So the time difference is a challenge for one thing, but we can work through that if we need to. Mainly we do say that a lot of our presentations are American focused. So when we talk about things like policies, for those folks, they may need to look locally, statewide, countrywide, whatever, to see what their version of that is. If what we have exists there or vice versa. We found a couple cases where it's actually more intense in the other country. But we also do that for our American folks too. You know, be sure to know your local, your state policies because they vary a lot. What else? Another thing that we do adjust for is that other countries don't necessarily require a master's in social work, like the United States does with the kind of level of practice that we do. So we make adjustments for that. So it's always fun to have people from other countries there.
Yeah, it's always a good conversation, especially around policies. And when we do animal assisted interventions around therapy animals and emotional support animals, it's always a good conversation.
Yeah, it comes up a lot with the link as well
Mm-hmm.
because the laws are very different. So
Yeah.
and what services are available always makes a difference as well. In some other countries, they don't seem to have as much like private practice as we do in the United States, so that makes a difference. Yeah, that's a good question.
I have a question. Do you find that the certificate program, I guess more job availability with that? Okay, so I'm in Dallas and there's two. So, and I'm with one.
Right.
And so I'm looking at this going, okay, I want to get the certificate, but is it going to be worth my time in the city since I've been here for this long and I will stay? Trying to convince and trying to market it is trying to say to the other veterinary clinics or where this is, this is what you're needing. It's catching on. I know that A&M has someone, Texas A&M, and has someone going through this certificate program. Right now, I just learned of that, but what's your thoughts on that? Because because it's being thrown around a lot. Basically, and I'm talking with the person that I had, she did not get their certificate. So so she's a VSW, but did not get the certificate. So that's my question.
Okay. So it depends, which is I know a horrible, annoying answer. So different organizations have different policies about it. MedVet has decided that they will hire people that don't have the social certificate, but it's part of their training.
It's part of their training, right? MedVet, yes, they're here, yeah.
Yeah. So, like once they get signed on, they come to us.
Okay.
So, you're right. You don't have to have the certificate to call yourself a veterinary social worker. Do I think sometimes it can make things easier to get yourself oriented to all the issues that are happening in the field? Yeah, I do.
Oh, I totally agree with that. Yeah.
Yeah. We've had people that have the certificate go for jobs and not get hired compared to somebody who doesn't. We've also had people that did get hired because they have the certificate. So I don't have a good answer for you. I'm sorry.
Okay.
Like as I mentioned it earlier, I think, everybody's experience is different. I think it's important that, we maintain social work code of ethics. You don't practice beyond your competence.
Absolutely.
And if you need the additional skills, you get them, whether you get them from us or somewhere else.
I know I've noticed when I do some like contract work with organizations, I'm like, just like Bethany said, you don't need to have a VSW, but I have found the clients that I've worked with, they want that because they feel like, again, it kind of helps them know okay, they're gonna know what we're experiencing. I work with vet clinics. They're gonna know what we're experiencing, and we're not gonna have to kind of train additional training or have a little bit of an uphill battle of, are they going to have a practitioner that might judge them, or all the things that we hear about in the negatives of mental health providers servicing veterinarians and staff. So I've noticed that a lot of the people that I've been working with were like, well, we don't need one, but we would like that. So it's always highly suggested that you have a VSW certificate or that you've gone through the training. And I don't know, Bethany, if you have any insight, but when I was doing the certificate program, there was talk of the language for like job postings of encouraging organizations that are hiring essentially a VSW to use that title instead of something else. I don't know if they're insight. That was just, I remember that topic coming up when I was in school.
I don't recall having that conversation recently. You know, I think there's still discussions in the field about what the difference is between a social worker versus another mental health professional. Or if they say, well, we're hiring a well-being director. Okay. So what does that mean? Do you want somebody coming in that has all the skills and knowledge of a master's level social worker? Or are you just trying to make the place more cheerful? Or, what are you actually aiming for here? So being clear about what it is the organization wants. I will also say that veterinary social work is still very entrepreneurial. So a lot of veterinary clinics right now, particularly the private ones, don't have the budget to hire a full-time social worker. But we do have a few that are like contract vet social workers. Or there's one in Massachusetts.
Yeah.
Somewhere up there.
Vet Unleashed.
Who describes herself kind of like as a mobile. Yeah. Yeah. So there are different ways, that it can be implemented. So just to say, if you want to get creative.
Would you say it would be licensed or not licensed? So do we need the, LMSW or not?
So you're gonna have to you would need to look at your state requirements for practicing.
Okay.
It would also depend exactly on the scope of what you're doing.
Okay.
Okay. Like for example, here in Tennessee, you need an LCSW to practice independently in a clinical setting. And so,
okay.
So I refer that to your state boards.
It's the same, but I'm just watching it all kind of unfold, and it's just very, like you said, very different how people market it. Like, I guess I said I'm seeing a lot of different varieties of words.
I mean, just from a social worker perspective, I personally, granted, I know every state is different, but that license being registered with your state board of health gives you an extra layer of credibility.
Oh, absolutely. And I take mine in February, so I'm excited.
Nice.
So that's why I was like, because I'm wanting also to go back into the hospital situation. So I know I'm going to need one anyway, but I'm dabbling in this a little bit and reading in the University of Tennessee, and I'm reading a lot of these things in different, different areas, and I'm just kind of getting my feet wet. And that's why I kind of wanted to join tonight, just to find out, what's going on. A little bit more information.
Yes, so definitely need to be clear about what the scope of your practice is, what you will and will not do, or cannot do with or without your license. And also be sure to have some good malpractice insurance, just in case.
Absolutely.
Yeah. But like, for example, my co-facilitator of the AAI, she is an LMSW. and she is a veterinary social worker. I'm an LCSW and I'm a veterinary social worker. So it just depends too on also the rules, but also do you want to do private individual or do you want to do more of that macro policy stuff? Yeah, which is kind of nice that we can have it at all different levels of social work.
Yeah, and so to clarify, Aviva does different work.
Oh, yeah.
So,
Well,
it's not
yeah,
doing that
exactly.
clinical.
Yeah.
Yeah.
So so for Texas, you get your LM, yeah. SW, then you get your 3,000 hours and you go for the LC. Yeah.
Yes.
Yeah.
Yes.
So that's what I didn't know. I guess getting into the certificate program. I need both?
No,
Okay.
no. So we want you registered with your state board, so an LM
You
is
want to
fine.
meet LM. Okay.
Yeah. LM
Okay.
is fine.
Okay.
And for anybody watching the recording, whatever license in your state, so an LSW,
Okay.
what else have I seen? LMSW, LISW, yeah. So
Okay.
license or registration with your state board
Okay.
as appropriate. So,
Okay.
How does that work with the people that are taking it with their MSW? Because they haven't taken their
right,
license and stuff.
right. So obviously if they're in the UT MSSW program, they're in that, it's separate. We occasionally will take somebody who's currently in their MSSW program. I'm leaning away from that due to complications that have occurred. But the caveat has always been that you can start the certificate, but you will not receive it until I have proof of graduation and that you are at least moving forward into whatever licensing process you're supposed to be doing.
Okay.
So for the current MSSW students. If you're not licensed and you want to get started, there is a waiver. It includes 2 letters of recommendation in addition to your other application materials for the postgraduate. I'm sorry, Zoom is probably filtering it out, but I have a cat down here who's just whacking his toy, so it's going round and round. Yes, so particularly for the post grad, we do like it that people have their MSSW and some experience under their belt versus master students who are still learning.
Mm-hmm.
What other questions are coming up?
I'll ask. So where is everybody else from who's on the call?
Yeah.
Let's start, go alphabetical. I'm Augusta. So I help organize these cafe chats. Currently the president of the International Association of Veterinary Social Work, or IAVSW for short. And I am now located in Virginia. I work at Virginia Tech in their small animal, well, actually in their teaching hospital as their VSW. Been doing it for about 3 months now. It feels much longer in the best possible way. But I also help with the postgraduate certificate portion, the AAI portion, president, and then do some contract stuff on the side of things like that, just to keep myself busy. But yeah, Bethany.
So Bethanie Poe, and I'm in Knoxville with the University of Tennessee. Matt?
Yeah, so I am in the southern tier of upstate New York, about 45 minutes south of Ithaca, if that means anything. And then I'm a humane educator at my local SPCA, a very small SPCA with just cats and dogs. And I am most of the way through my Master of Social Work at Binghamton University.
Liz?
Yeah, hi. I'm about 60 minutes north of Matt in Syracuse, New York. And I graduated from my MSW last year to Mary. So getting hopefully it's through my application for licensure soon. Been working in the veterinary industry for 20 years at the same practice. And I do some work on the side for my clinical work with the New American population.
Oh, okay.
And Amy?
I am in Chicago. I got my master's in 2015. I have been doing community mental health since I graduated my master's, and I have my LSW in Illinois.
Oh, okay.
Mary, you said you're in Dallas, right?
So yes, I graduated from University of Texas in Arlington in May. And like I said, my background is a long time, 25 years as an occupational therapist. Um, through through the pandemic, thinking, hey, I need to do something different, I guess you would say. And so I just picked, and I thought, let's just do social work. And so I'm really into, so I did this, and now I'm trying to figure out, go back into the hospital as a social worker, um, in, um, in that. But as I'm doing my licensure, and so as I'm waiting for this, I thought I'll dabble a little bit of this, because I was going to say we only have one, another med vet, I think, is in Dallas. But it was interesting. I guess my daughter, I know Virginia Tech very well.
Nice.
She did her first internship after graduating from A&M at Virginia Tech.
Very cool.
So I bet we can crisscross people.
Absolutely. That's awesome. Small
And
world.
then, yeah, exactly. And then she is cardiac. So basically her specialty, so she's at Mizzou in Missouri right now doing her fellowship, and she's in her second year. So the cardiac crowd, I know, but I also know, I didn't know, who is your head of the department? Do you know your small
So I
animal?
report to the director of the hospital, Terry Swecker.
Okay.
And then I'm still learning everybody and finding all of their locations in the large hospital. Because they like to tuck, especially cardio likes to be tucked around the corner, so everything's dark for their ultrasound or their very fancy machine. So yeah.
Have you met the what do I want to say, the veterinary school social worker?
So Trish,
It's Trish, yes.
yep. So she stepped down and then I took her role. So she laid a
Okay.
very good foundation for me. So we're always paving the way for each other.
Oh yeah, I know. My daughter was very good friends with Trish.
Very nice. Well,
Yeah.
I'll tell her.
So
I
I'll
know
tell her
Trish
that
would
she's
probably definitely say hello. And yeah,
okay.
have her
Yeah,
reach
because
out anytime.
that'll be great. No, because I was honestly going to reach out to Trish sometime in this month sometime. So now I know that if I did, then now I know that yeah, that's perfect. That's great.
One
See
stop
how
shop.
it's just a
These
small world.
cafes. Yeah, these cafes are one stop shop. So
Very true.
find me every month here.
Okay, that's good.
But social work is a growing but still small community, so everybody, it's sort of like that Kevin Bacon game.
Yeah.
Just the 6 degrees of the veterinary social worker.
Mm-hmm.
Mm-hmm.
It almost seems like it's more like 4 degrees, if that. So
Yeah. Yeah. You don't
3
usually have to go
degrees.
6. Yeah.
Depend on who you talk to for sure.
Mm-hmm.
Which I think for me, so I did the certificate when I was earning my MSW from UTK. And I always say, like, that is my favorite thing of the certificate. And like one of the long lasting things is the networking. I
Mhm.
mean, the people I still talk to, and it's been, 5+ years, and they've all become really great, close friends, most of them. So I would say that is worth everything in itself. So
And Augusta, did you work in the veterinary field before this?
Yeah. So I was a vet assistant, worked in the ICU, and I had a minor in psychology or a major in psychology, a BS in psychology. And I was the one that didn't mind interacting with the clients. So I got pushed and voluntold a lot of times to go work with the clients and really enjoyed it. And I was partnered up with a DVM that actually graduated from UTK. And she told me that there was some wonderful people. And she's like, I think they were therapists. They did something with that, but we would go to their office and they would always just be really great and they would help with the clients. And I went home, discovered veterinary social work, and like applied that week. Like this, like the light bulb went off. And yeah, the rest is history. So yeah. And also another great part of this program is you always get to see people's pets. So
Yes.
That's true. I
Wow,
think
big bonus.
cute.
gorgeous cat. Oh my
Gorgeous.
gosh. Thank you.
Whacking the toy didn't work, so he was over here pawing at me and squeaking. Like, Mom, what are we
It is
doing?
late.
Is that a ragdoll breed?
So I am the person who gets cat DNA done, turns out.
Mhm. I get it. I support you.
So supposedly he is 3.3% ragdoll, but it seems like all those genes were expressed because he acts like one, he looks a lot like one,
Mhm.
and very people oriented, and so, and just kind of
Are you gonna
we
make him
jumped
a
down.
therapy cat?
Honestly, if I worked with them more when they were teeny, they probably would have been great. I have his brother as well. They're Knox and Nash, so Knoxville, Nashville.
Nice.
Because at the time I was based in Nashville, and so I always felt like my life was torn between the two because I was going back and forth.
Mhm.
So, um, so yeah, both of them are very easily to handle. They like people pretty well. So if I worked with them, they probably would have been good therapy cats. Now they're very spoiled and kind of oriented to me. So yeah, they're not going to be.
Well, I'm just curious with everybody. So Augusta, how did you get to Virginia Tech?
So I had
Just
I
in
had
a question.
right. I had actually so I had graduated in May and I had taken off for maternity leave. So I joke and say that my daughter also had earned the certificate program. So I had taken off, and the very first job that I applied to was Virginia Tech. Obviously, I did not get it because I was brand new in this field of social work, but I had always had the goal of being in the academic setting. Moved to Maine, of all places, and saw that this position had opened again. And I'm like, I I have to. I have to apply. So put everything on the line, got the job, and moved down here. So
That's great.
yeah, it was just one of those things. I liked the model of um the center had because I was able to go in person for the intensive down there over spring break and just really enjoyed being in the academic setting and kind of to me it felt like being as proactive as I could of helping the students and growing their skill set before they went into practice. So I really liked kind of that model. But I also did a lot of access to veterinary care too. So I dived into animal welfare, and that was a brand new world that I had never even considered. And it made so much sense and aligned so well with social work that I was like, oh, there's something here too. So I dabble in a little bit. So yeah, long story short, I took a chance and reapplied and made my family move back down south. So it worked out. So far, it's been wonderful.
Well, I was gonna say, yeah, and we liked Virginia Tech, and I guess as we, because I was always flying to Charlotte to drive up. and everything. So I've got kind of that area down now, where you can eat in the restaurants and everything down, because she was there for she stayed for 2 years. But what's interesting, your academia, I'm learning a lot about that, is that she also liked academia. And so she is, so I've met the social worker at Mizzou who is not a veterinary social worker. So it's very interesting to just talk to someone that they took the academia job, but after understanding your predecessor is Trish, is what her role was, because she didn't know really what her role was per se. And she really didn't. And I think that was something to learn. And I wasn't even looking at social work at the time. So it was just one of these things that, you know, kind of goes around. And just to understand that academia really does need the help. They need to understand the colleges really do. And even down here at UT Arlington, this is the first time, I think, the first semester that a clinic has opened up for any interns, because Dallas does not have one. I mean, they did not have a veterinarian social worker.
Yeah.
And you would think in a large city, but it is the cost. If you're going to pay X amount for not having a income or a salary that brings in any money in the vet clinics, that is an issue, I guess, more down here. And I'm sure it is all around. And that's why I asked the job, because I was interested to, I would like to go to the certification. But then again, I'm kind of like, well, what state has the most veterinary social workers? Bethany, do you know?
Like Ohio for some reason.
Ohio does
So
have quite a
many.
few. So I mean, the reality is that it depends what you want. So if you are willing to, if you're looking for a job that is there, you apply, you take it, or you know, get it and take it, great.
Right.
Those are still building. You know, they're not as common as we'd like yet. They're better. There was a time when you could Google veterinary social work and nothing came up.
Nothing came up. That's true.
But it's, you know, that they did not exist. So it's growing. If you're willing and it fits in with what you want for your life, to maybe think outside the box and maybe have a private practice that you focus on veterinarians, or you contract with vet clinics, or you build what you want.
Yes. Okay.
Yeah. That can happen too. But I also understand, you know, everybody's different. So it's a matter of what you want your life to look like.
Well, and that's why I didn't. So, and that's why I was thinking, well, do I need to move to Knoxville?
No.
I just want to mention how far across UTK made it. We have a local initiative, because our private practice veterinary hospital, it's a 24 emergency center, was closed down 2 days a week because of COVID and the employee retention and the crisis in veterinary medicine, mental health crisis, and in professionals. And I know we're nearing the end here, we're over, whatever, but briefly, this amazing veterinarian that retired, and she's done a lot for Cornell University, she started an initiative, and in that initiative, they developed a scholarship for members in veterinary medicine who are interested in doing the certificate as an educator for a veterinary technician. So they have this stipulation that you have to work in emergency medicine, because they're really trying to get people staying and remaining in vet emergency med versus general practice. And they offer a full scholarship for that program for the certificate for veterinary technicians. So I think that it just demonstrates the need and also the acknowledgement of our communities and what I have done as far as like promoting what this looks like and just my little piece of the pie, right? But like this awareness that we're demonstrating. So so UTK's on there for for that certificate part, which is great for the scholarship.
That is awesome. Thank you.
That's very cool.
I did not know that.
Well, I'm sitting in the emergency part too. So I'm honestly the 24-hour emergency clinic. And just like I said, I've just been in there 2 months. And just the fact that just because I'm a volunteer per se, but just to having taken the pressure and the stress and the off of the the doctors and the vet techs in going through this process. It is amazing. And people are missing the boat. And I feel like this is so new, but definitely needs to be more marketable and more spoken out on and different platforms, I would say, because it is something that is definitely needed. The clinic that I'm doing or I'm with right now is one of the doctors his whole passion is euthanasia, and that is his thing. He basically, and so the reason why there is one there is because of his background of and wanting to have a mental health on staff and trying to figure out what he can help his staff and the clients that are coming in. So I think it really also starts with I guess the veterinarian or what their background is too.
Yeah, definitely makes a difference.
Yeah. Well, I am always open to keep things going and talking, but I want to be mindful of everybody's time. So if you have to hop off, thank you for coming. Always appreciate the conversation. We'll stop recording and then